Dr. Brad Jerson today, the Pediatric Psychologist of the IBD Center. What does a Pediatric Psychologist do?
So clearly there are many different types of psychologists, and pediatric psychologists are those who have extra specialization in working with children, adolescents, and their families in dealing with medical issues and understanding how to adjust to different situations and promoting ideal, healthy quality of life.
Why would someone meet with you?
So especially in our IBD world here, and any real medical illness at all, having a medical illness is a big adjustment for a child, a teenager, all family members. So getting a diagnosis of a new medical issue is a big deal. And it's not an easy one. So we know that it's really important to address the issues that come along with that. So it can be challenging to say, how is this going to affect me in my school? And how is this going to affect my daily routine? And someone might meet with a psychologist just to say, what can we do to help me cope a little bit better with this new routine? And also, we know that it's totally understandable for there to be a wide range of emotions that accompany a new medical diagnosis. So with that, we are expecting a lot of times for there to be some anxiety, some depression, some pain, some nervousness about things, and we work through and try to come up with ideal coping strategies to how to deal with all of that.
So if I talk to you, does it mean there's something wrong with me?
Totally not. That's a great question, and it is completely normal to talk with a psychologist, and there's unfortunately so many myths and misconceptions about what a psychologist does and why someone would meet with a psychologist. We in our IBD program kind of just work it into the standard of care. We know that we are all humans and we deal with things in complex ways, so let's take the time to appreciate the way that these different situations affect us, and we'll help everyone feel a little bit better.
Will I have to lie down on a couch?
So I actually do have a couch in my office, but there is no mandate to lie down on it. And this ties into all these stereotypes about psychologists, and I guarantee you that what a pediatric psychologist looks like in a medical center is very different than what a psychologist looks like on TV or in movies. And there is a goal with pediatric psychologists, especially in our program, to say, let's work together. There's no secrets. I don't have any hidden tricks up my sleeve. I'm going to be really transparent and say, what are the things you want to change? What do you want to be a little bit better, or what could be tweaked a little bit? And let's figure that out together. It's very active, it's very collaborative. We come up with problem-solving strategies together. So if you want to lay down on the couch, you totally can, but it's going to be a little bit more comfortable than it looks like.
So do you have any tips or suggestions on how to talk to my friends and teachers and family about IBD?
Yeah. So having an IBD diagnosis, like I talked about before, can be a really emotionally overwhelming one. And also, one of the complex things that is different about IBD compared to a lot of other medical illnesses is that it's not visibly apparent to everyone. You're not going to be able to walk around and have people understand that you have a medical problem. The associated pain symptoms, those are invisible. Having the symptoms that go along with the frequent side effects of treatments or the disease itself, those are all invisible. So it's up to everyone individually to say, how much do I want my friends to know? How much do I want my teachers to know? But we work together in kind of determining what's the best strategy for you.
Well, thank you so much.
Yeah, this was a pleasure. Thank you.